Hello, this is a reading of Ignite Minds Pandemic Action Plan working document. This is a working document describing how Ignite Minds will respond to the COVID-19 pandemic given the different scenarios that may be presented to us. This is an evolving document and will be updated as information becomes available. It was last updated on the 15th of March 2020. Australia is facing a health crisis that has not been felt in our lifetime. Now is the time to take care of yourself, check in on your neighbours and be generous to your community. Be sensitive to other members of our community. The Australian government is tracing all people that have been in contact with with the virus, and there is absolutely no place for discrimination or treating people of Asian or Arab appearance or anyone with suspicion for that matter. This is a virus that has most adverse effects on the elderly and people with a compromised immune system. Whilst the media has flooded us with the latest scientific advice and data, I have included some links below. Here are also some out-of-the-box strategies for reducing the impacts of stress and anxiety so you can boost your immune system. Be grateful for something. Gratitude is an emotion that reduces anxiety, and anxiety rapidly depletes your immune system. Eat fresh fruit and vegetables. Exercise and walk in the open air. Listen to your body. If you're feeling depleted, now is the time to top up, rest and consult a dietitian or health practitioner. Ignite Minds risk profile. Ignite Minds Family Daycare has 269 families enrolling a total of 385 children across 42 family daycare centres. This is an average of 6.5 families per educator. Given the low population of each centre and the geographical spread of Ignite Minds service locations, it is possible that some services will be affected and others will remain open. Current health information is that the virus will peak in 2 to 4 months, so we may be in for a long period of service disruptions and compromise. We all have to make adjustments and compromise to ensure the health, well-being and livelihoods of all members of our community. All staff, educators, including educator family members, assistants and volunteers, enrolled children and enrolled child families will need to be hypervigilant and monitor their own health and symptoms. People who have returned from a country or region that is at high or moderate risk of COVID-19 should monitor their health closely. If you develop symptoms including a fever and cough, you should isolate yourself immediately and urgently seek medical attention. I've provided a link for the latest travel advice. If there is a confirmed case of COVID-19 at an Ignite Minds service, all children and educators will be required to self-isolate until gaining a medical clearance. If you have been in contact with a confirmed case of COVID-19, you are required to let Ignite Minds know and to self-isolate until you obtain medical clearance. Once cleared, families may seek alternative care by using the Educator Finder on our website. So, what if a child, parent or staff member becomes sick whilst in isolation? Symptoms include, but are not limited to, fever, cough, sore throat, fatigue and shortness of breath. If a child or staff member develops mild symptoms, they must isolate themselves from others at home and use separate bathroom if available. Put on a surgical mask, and if they don't have one, practice good sneeze, cough hygiene. Practice good hand hygiene and call a doctor or hospital and tell them the recent travel or close contact history. If they have serious symptoms such as difficulty breathing, please call 000 and ask for an ambulance and notify the officers of the recent travel and close contact history. More information and fact sheets, there's a link that's been provided. Hygiene procedures. All customers entering Ignite Minds and Dragonfly Toy Shop will be requested to use the hand sanitizer. All contact services including phones, desks, door handles will be sanitised regularly. The World Health Organization has published an emergency guide to small-scale hand sanitizer production. We've provided the link because it's in short supply. All support staff will ring educators prior to visits to confirm if there are any symptoms prior to attending. All educators will insist all visitors, children and staff wash hands with soap and water immediately upon arrival. Where a staff member becomes diagnosed or self-isolates due to contact with a confirmed case, we will suspend all support visits, suspend all playgroups and staff will work from home. Families are requested to ensure all children wash hands with soapy water for the duration of the song Twinkle Twinkle Little Star, whenever they return to home and prior to consumption of food. Wherever possible, please change into home clothes and increase your laundry frequency. Please support us to educate your children about not touching their face or putting their fingers in their mouths. What if my child's school is closed, but my child has not come into contact with COVID-19 and does not have any symptoms? Your child will need to be tested and cleared by a medical practitioner prior to attending family daycare. Educators can care for up to 7 children at a time, providing that no more children are younger than school age. So please contact your educator and discuss the possibility of older siblings attending care. Financial risks. Families who are self-isolating or infected may not be covered by paid leave and will experience financial hardship. All working adults should explore unemployment insurance, and this is cheapest through your existing super funds. Educators are independent contractors and do not receive sick leave, holiday pay, or payment where children are not enrolled. Ignite Minds is dependent on educator levies to pay admin and coordination staff. Financial procedures. All decisions will be made on a case-by-case basis, and the overriding principle for assessment will be ensuring the health and well-being and livelihood of all parties. It is anticipated that there will be a high level of compromise from all parties to ensure the maximum good. Where a child or a child's family is self-isolating but unconfirmed COVID-19, they will be charged a usual absent day, and the usual childcare subsidy will apply. Where a child's family is confirmed to have COVID-19 and extended employment leave is not covered by a paid leave arrangement, they should immediately provide a medical certificate and a letter from their employer clearly stating that they are on unpaid leave. In this situation, Ignite Minds will apply for additional childcare subsidy, which is up to 120% of the usual childcare subsidy, to a maximum of $13.32 per hour. Ignite Minds will apply for this additional subsidy for a period of 13 weeks in anticipation of the financial hardship families will experience during illness and recovery period. This will ensure your educator has some income during your absence and that they can hold your permanent booking for when you recover and return. Where an educator's usual fee is higher than the additional childcare subsidy cap, Ignite Minds will impose a cap on the educator fee equivalent to the additional childcare subsidy to ensure families are not charged during their sickness or recovery period. Children can return to family daycare once medical clearance has been provided. Where children return to care within a 13-week additional childcare subsidy period, the additional childcare subsidy will continue, however, the usual educator fee will apply. There's a link provided for additional support for understanding the childcare system and also a link for the latest COVID-19 alerts and information. Thank you for listening.